So both Julia and Diane touched on trigger programs earlier today, so I'm going to talk about one of the trigger programs at Mount Sinai. So here's a brief background. For patients with advanced cancer, integration of palliative care improves symptom control, clarifies understanding of prognosis, increases utilization of hospice, and lowers utilization of healthcare resources. In 2012, the American Society of Clinical Oncology issued a provisional opinion recommending incorporation of palliative care for any patient with metastatic cancer and/or high symptom burden. So prior to the initiation of the trigger program, the criteria were pilot tested at Mount Sinai and reviewed by the members of the oncology faculty. And so the goal was to improve patient care through formal integration of palliative care for patients with metastatic solid tumors who met one of the following criteria: stage 4 disease, stage 3 lung or pancreatic cancer, prior hospitalization within 30 days, hospitalization lasting longer than 7 days, and/or uncontrolled symptoms, pain, nausea, dyspnea, delirium, and psychological distress. And during the 3-month pilot initiative, all patients admitted to the solid tumor service were reviewed at daily multidisciplinary rounds. And if a patient met the eligibility criteria, a palliative care consult was called by the house staff, fellow, nurse practitioner, or oncology attending. If for some reason the consults weren't initiated, we had a research coordinator who attended these daily meetings and kind of nudged the oncology team to pick up the phone and call the consult team. Okay, so looking at the results, here's a comparison of patients who met the eligibility criteria. So we have the observation group. The number of patients in that group is 51, and the intervention group 68. And you'll see that the PALCare consult rate increased, the 30-day readmission rate decreased, and hospice utilization increased. And we know while this is not statistically significant, given the size of the patient population, it's leaning towards being clinically meaningful. And here's another results slide comparing the University Health System Consortium quality indexes. And so what we did was compare the indexes of patients that came in 1 year prior to the pilot study. And you can see that the observation group compared to the intervention group, that 30-day readmission rate, decrease, mortality index decreased also, and slight bump in the length of stay index. And in conclusion, formalizing a criteria for palliative care consultation was very, very easy to do, to implement, highly effective, and led to improvement in multiple quality measures. At Mount Sinai, this became the standard of care. We have expanded our palliative care service so that all cancer patients who meet criteria will get the services they need. And these criteria are applicable to hospitals nationwide, and if adopted, will lead to improvement in care for sick metastatic cancer patients. Of course, the limitation of the study is that it was a small pilot study, but we continue to collect measures and hope to analyze that data soon. Thank you.